You see that? What's on my screen? Or you just see the presentation?
No, I see this. I don't see anything else that's on your screen. I just see the presentation. Sharonda, I am putting you over as a panelist in case you wonder what's going on. See if okay. Good morning, everyone. So we're gonna get started. If you know people that aren't here and they are on social media, we will be on Facebook Live, on YouTube, on LinkedIn. So we're making sure, and on X. So we are going to be live on all of those mediums. So if you know someone who is not able to get here, they're able to pop in on um, the other venues. So we just want to make sure that you know that before we get started. And I'm going to start you off this morning on this Saturday morning. Good morning, everyone. I'm Ivanka Hall, Executive Director of the nationally recognized Northeast Ohio Black Health Coalition. We are the first coalition in the state of Ohio to focus exclusively on African American disparities. We work to create equity by addressing the cumulative impact of racial, economic, environmental, and social justice inequities in the African American community. And so for our case, we look at the social and structural determinants of health um, for in communities of concern. And I see that someone has their hand raised. Um, Ms. Dyson, I know the chat feature doesn't work, so you might want to put your question into the Q&A. So good morning. So I introduced myself and I'm going to have Dr. Pugh introduce herself and then we'll talk about the reason why we're here this morning.
Good morning. I'm Dr. Lachelle Pugh. I'm the Assistant Executive Director for the Northeast Ohio Black Health Coalition, and we're happy to have all of you with us today. We hope you will find this session informational, um, and we hope you learn some new information to take away. Thank you for being here.
And I know that Dr. Pugh is going to monitor the Q&A. So if you have, I know that we have something in there right now, Dr. Pugh. And so part of our engagement is we also have Sharonda Whitner, who is with the asthma program for the state of Ohio, the Ohio Department of Health asthma program. Um, Sharonda, do you want to say a few words before we get started?
Absolutely. Thank you so much for allowing us to, join you today. We're very excited for this work. The minority contract that you guys have really is putting information out to the community. Um, and I'm sure, you've got lots of information, but there's also, please go to Ivanka's website. Her YouTube page also has additional resources for asthma, in addition to what she's going to share today. But we really appreciate the partnership and support. And, we've also created some YouTube things that Ivanka has posted on her website from the Ohio Department of Health. So we certainly appreciate that. And if there are any community members here, we have an Asthma Care Improvement Collaborative meeting. And that is something in which you can join the conversation. And we do a monthly meeting and we discuss asthma rates. We discuss tips and tricks and tools. So we certainly applaud the work that you're doing. And thank you so much for inviting us.
Thank you so much for being here. I tried to put you as a panelist.
I know it doesn't have a view for me to put my image. It just says audio, but that's okay. We appreciate being here. No problems.
Oh, okay. I don't know what happened then because
That's okay. I got myself ready, girl, but that's okay. Don't worry
okay.
about
Look,
it.
I'm gonna keep working with that. I'm gonna keep working with that. We want to see you.
Okay,
Um,
no problem. I'm here.
so for us, part of the reasons that we're here is because one of the things that we have looked at is we looked at the emergency room, the rate of
Hi,
emergency room
everyone.
visits
Welcome.
and the rate of deaths in Cuyahoga County, for particularly for the African American community. And so when we look at what's going on across the state, African Americans experience higher prevalence of asthma compared to our white counterparts. And that we are also have experienced higher rates of emergency department visits, which are more than over 6 times that of our white counterparts. African Americans have experienced asthma rate inpatient hospitalization rates at almost 6 times that of our white counterparts. And so when we look at what's going on with African Americans, our death rates are about 2.5 times higher than our white counterparts. One of the things that was more alarming to me than anything around our race is when we look at the rates of our children. Black children have a higher prevalence of asthma compared to their white counterparts. Black children experience asthma-related emergency department visits at a rate of about 5.7 times that of their white counterparts, and Black children experience asthma-related deaths at a rate of approximately 14 times that of their white counterparts. Let me repeat that again. Black children, it's asthma-related deaths at a rate of approximately 14 times that of their white counterparts. That is why we have sounded the alarm. So our asthma project has sounded the alarm and looked to engage our community engagement pieces, minority community engagement pieces within our counties. We are focusing our efforts on Cuyahoga, Mahoning, and Lorain County. And we also have sessions that will take place in those counties immediately following these. So I know that later on today, we'll be looking at Lorain County at 11:30, and then at 1 p.m., we'll be focusing on Mahoning County. Why the information around asthma is so important is that over 25% of adults have missed at least one day of work due to an asthma-related illness. Over 20% of children have missed at least one day of school. 8% of adults limit their activity due to asthma, and about 33% of children limit their activities due to asthma. In Ohio, 1 in 10 adults currently have asthma, and 1 in 12 children. About 14.5% of adults have been told at some point in their life that they have asthma. And so it is important for us to look at some of the other contributing things that when we look at asthma. One of them is obesity. About 1 in 2 adults that currently have asthma are obese, versus about 1 in 4 adults that currently have asthma are normal weight. The depression in our adults with asthma, adults who currently have asthma are over 2 times more likely to be diagnosed with depression, a depressive disorder, compared to adults who do not currently have asthma. We also have to talk about some of the other chronic disorders that we look at when we're looking at asthma: COPD, emphysema, bronchitis. I have bronchitis, and like I told Dr. Pugh, I've been having some issues for the last few days around my breathing. So if I sound like I'm breathing hard, it's because I am. I know that we have done some cleanups in the office, and so it caused some dust to be here. So we've actually put
Hi, everyone.
some of our other
Hi,
systems
everyone.
in place
Okay.
in
Hi.
order to do some air purification. Um, the other part of looking at asthma is making sure that we understand the information around smoking, whether it's firsthand smoke, which is smoke that's inhaled by a smoker, secondhand smoke, which is smokes that are exhaled by a smoker or released from the end of a burning cigarette or a vaping device. But we also have to know about third-hand smoke. And third-hand smoke is the toxic residue that sticks to surfaces and dust after the smoke clears. So this is the residue that's in your clothes, on your teddy bears, on your couch. And so when people are coming into those spaces that you have been, then if they have either allergies or asthma, it may trigger it. So thinking about other people who visit your spaces or that you're inviting into your spaces is vitally important when we're talking about what we need to do to combat asthma. The other thing are these 6 exhale strategies. And so when we talk about this exhale strategy, it's the best available evidence that we have in order for us to control asthma. One is education on asthma self-management. The other one is extinguishing smoking and secondhand smoke and thirdhand smoke, which we just talked about. The other is home visits for trigger reduction and asthma self-management education. So making sure that if you have asthma and you're going to your doctor, usually they have some programs that are available in some of our counties that'll actually come out and actually come through and look at your space. Achieving guidelines for based medical management. So making sure that you're going to your doctor, that is vitally important. Making sure that you have that inhaler and making sure that you have the refills that you need. A lot of times what happens is when we don't have an immediate when we're not haven't had an episode, we kind of forget that we had that inhaler and that we need that inhaler. And so making sure that you are keeping that up to date. Linkages and coordination across care settings. So making sure that all of your providers know about your asthma or about the asthma of your child or family member. And for many of you who are also providers, I know we have some ministers that want understanding what's going on with the people who are in your churches. And the fact that you may have people who are triggered because of asthma. Environmental policies and best practices to reduce asthma triggers indoors, outdoors, and in occupational settings. And so we are going to talk about all that, but we're going to show you a video and then we're going to come back and finish out the session. So Dr. Pugh, you want to start our video?
Hi, everyone. Welcome. Good to be here. My name is Lynn Bosma. I am the Health Equity and Outreach Program Manager with the Asthma and Allergy Foundation of America. And my colleague here is Jessica Jackson, who's AFA's Asthma and Respiratory Health Program Manager. And we are going to talk with you a little bit today about asthma self-management. Okay, here's our quick agenda. We're going to talk briefly about some facts, some things about health disparities, some asthma basics, some tips on how to manage asthma and avoid triggers, some resources, and where to submit questions. So if you're not familiar with AFA, we are a national patient advocacy organization, was founded in 1953. We're the leading patient organization for people with asthma, allergies, and the oldest asthma and allergy patient group in the world. Our mission is dedicated, AFA is dedicated to saving lives and reducing the burden of disease for people with asthma and allergies through advocacy, education, research, and support. So I'm going to talk with you a little bit about some asthma facts. So asthma is one of the most common and costly diseases in the United States. Over 27 million people in the US have asthma. This is about equals to 1 in 12 people. It's a leading chronic disease in children. About 4.5 million children under the age of 18 live with asthma. It's more common in male than female children. And non-Hispanic Black children are nearly 2 times more likely to have asthma compared to non-Hispanic white children. Adults, some asthma facts for adults. So 22 million US adults aged 18 and older have asthma. And asthma is more common in the adult population in females, so it's flip than males, 10.8% of the versus 6.5. And asthma rates are highest in American Indian or Alaska Native adults in the US. This is a slide discussing the burden of asthma on the Black, Hispanic, and Indigenous individuals in the US. Unfortunately, the burden of asthma falls heavily on these communities, and they're at the highest risk of asthma rates, hospital visits, and deaths. Black people in the US are nearly 6 times more likely than white people to visit the emergency department due to asthma. So AFA knows that this can help us shape how we approach health education in all communities. And we work on policy changes to ensure equitable access to things like healthcare and other resources. Talking about health disparities, we know that health disparities result from a series of factors, many of which stem from environmental or social injustices. So racial and ethnic disparities, they're complex and they vary across levels of social structure and genetic factors. Things like unequal distribution of stressors in people's environment. So things like living in poverty, not having access to good housing, not having access to things like quality health care, things like that can be part of those systemic injustices that I mentioned, and racism that has been deeply ingrained in the US policies and culture. Things like we referred to some of in the healthcare space, you might hear the term social determinants, and those are listed on your slide there. And it's speaking about situations that people are born in that determine health status, things like education, whether people have access to healthy neighborhood and social support. Looking at the environmental conditions that contribute to health disparities, hazardous environmental exposures are a growing concern, especially in light of climate change. So exposure to hazards can have a significant impact on health conditions like asthma. The risk of exposure to environmental health hazards depends on where you live. So some communities, such as low income or communities of color, are more likely to reside in neighborhoods that were founded on racial segregation and other environmental justice. So many economically disadvantaged communities are in close proximity to industrial and hazardous waste sites, for example. And these sites are known to release toxins and contaminants that disproportionately burden those surrounding neighborhoods living in that community. So that increases people's exposure to environmental health hazards, which enhances the risk of poor health outcomes. So talking about health equity, that was a lot of discussion about the concept of health disparity. So flipping it, health equity is really what AFA is committed as a core value to improving, and it's a mission critical priority of the organization. So health equity is a state in which everyone has a fair and just opportunity to reach their highest level of health. And we as an organization know that it requires strong, coordinated efforts in communities, nationally, locally, working on policies, systems improvement, and reducing and eliminating personal biases that are causing harm to many communities. So we're going to talk a little bit about asthma basics. I'm going to hand this over to my colleague, Jessica, who will share some general information about asthma.
Great. Thanks so much, Lynn. So first I'd like to just share some information about what asthma is. So essentially, asthma is a chronic lung disease that causes inflammation and also narrowing of the airways. And this inflammation and narrowing can lead to asthma symptoms, which can be any combination of coughing, wheezing, shortness of breath, and or chest tightness or pain. So unfortunately, there's no cure for asthma, but it can be controlled with the right combination of medications and trigger control strategies. And when these medications are taken properly as prescribed, and also when triggers are controlled, most people with asthma can actually live a healthy and active life. So a lot of factors have been linked to an increased risk of developing asthma, but it's very difficult to find a single direct cause. However, it does appear that asthma is more likely if someone in your family also has asthma, especially if that person's a close relative, like a parent or a sibling. Asthma is also more likely in people who have other allergic conditions like eczema or rhinitis, which is just another name for hay fever. Additionally, urbanization, it's associated with an increased asthma prevalence, and this is likely due to multiple lifestyle factors. And events in early life can also affect the risk of asthma. So essentially, it impacts the developing lungs, and this can increase asthma. And these factors include low birth weight, prematurity, exposure to tobacco smoke, and other sources of air pollution. And it also includes viral respiratory infections. So exposure to a wide range of environmental triggers such as allergens and irritants are also thought to increase the risk of asthma. And this includes indoor and outdoor air pollution, things like house dust, molds, occupational exposure to chemicals, fumes, dust, and other triggers. And then finally, children and adults who are overweight or obese, they're also at greater risk of developing asthma. So, with asthma, there are three main changes that take place in the airway. So, first, asthma causes inflammation and it also causes an overproduction of mucus inside the airways. And this, in turn, it causes the airways to become overly sensitive or hypersensitive. And this hypersensitivity makes the muscles that are wrapped around the airways spasm. And this is known as bronchospasm. So the inflammation, the overproduction of mucus, and the bronchospasm causes the airways to become very narrow, and this narrowing leads to asthma symptoms. So fortunately, even though there's no cure for asthma, it can be managed with three steps. First, avoid asthma triggers, so the things that make your asthma worse. Second, take medications to prevent and control your asthma symptoms. And then third, you want to treat your asthma episodes if they occur. And we'll discuss this more throughout the presentation. So people with asthma, they have airways that are sensitive to certain things that might not bother people who don't have asthma. And these things are called triggers, and they vary from person to person. So when a person with asthma is exposed to something they're sensitive to, this causes an inflammatory response inside the lungs. And this inflammatory response, again, leads to asthma symptoms. And so examples of common triggers include allergens, and this can be things like pollen or dust or mold, animal dander. Irritants can also trigger asthma, and examples of irritants include smoke, chemicals, perfumes. Another very common trigger is respiratory illnesses, things like colds, the flu, and additionally, strong emotions, exercising, weather changes, or extreme weather, and GERD, which is another name for acid reflux, can also cause asthma symptoms. And other less common triggers include foods, especially those that contain things like sulfites. So an example could be like wine or sometimes foods like shrimp or dried fruit. Some people are also sensitive to certain types of medications, like NSAIDs. And an example of an NSAID would be something like ibuprofen. And then others can be sensitive to certain types of heart medications, like beta blockers. So in general, it's really important for people with asthma to avoid their triggers, and you can do this by adopting multi-component strategies. The one exception to this, though, is exercise, in the sense that it shouldn't necessarily be avoided. So usually providers will have people with exercise-induced asthma, or it's also called exercise-induced bronchoconstriction, pre-treat with a medicine, usually about 10 to 30 minutes prior to exercising or being physically active. So there are many medications that can treat asthma, and they're divided into three main categories. So first, there are controller medications, which your provider may have you take daily, even if you aren't necessarily having symptoms. And controllers, they address the underlying issue of asthma in the sense that they reduce the inflammation and the overproduction of mucus inside the airways. And controllers typically work very slowly over a long period of time. And then quick relief medications, these are used as needed. They don't address the underlying issue of asthma in the sense that they don't really do a whole lot for the inflammation and the overproduction of mucus inside the airways. They do, however, temporarily relax the muscles that are wrapped around the airways. And when those muscles relax, this pulls the airways open, which creates a much bigger space to breathe inside the airways. And so quick relief medications, they work very fast, but they don't last long. So typically their effects last about 1 to 4 hours, depending upon the person. And then finally, there are combination medications that aim to both control and relieve. And this is called smart therapy. And we'll discuss that more on the next slide. So essentially, smart therapy, it combines controller and reliever medications into one inhaler. And again, it can be used to both prevent asthma symptoms or relieve them. And two examples of these types of medications are Symbicort and Delura. So these are both inhalers, and they have a combination again of controller and reliever. Be controlled with the right asthma management
Michelle, it popped off. The volume. The volume went off. The volume is still off. Michelle. Can you go back and turn the volume on? But you can't hear the video.
Okay, yeah, I was gonna say I couldn't hear it either.
Yeah. Give us 1 second. Is it something else that you pulled up?
Oh, let's see if this works.
Try to limit your outdoor
Yeah.
activities when pollen counts are
Okay.
high. And this will cut down on the amount of pollen allergen that you inhale, and it also can help reduce your symptoms. Another strategy is to keep windows closed during pollen season or peak pollen times. And also, if you have it, try to use central air conditioning or air cleaners with a certified asthma and allergy-friendly filter and or a HEPA filtration device to reduce indoor airborne allergens. Additionally, you can wear sunglasses and also cover your hair when going outside. And this keeps pollen out of your eyes and also off of your hair. And then you want to be sure to shower daily before going to bed. So this removes the pollen from your body and it also keeps it off of your bedding. And additionally, you want to limit close contact with pets that spend a lot of time outdoors. So one strategy is just to wipe furry animals off when they come inside, or if you can, bathe them weekly. Additionally, changing and washing your clothes that you wear during outdoor activities is really important. This also washes the pollen off. And then when you dry your clothes, be sure to put them in a clothes dryer or hang them up inside. Don't dry them on an outdoor line because this will just collect more pollen. And then finally, you just want to keep an eye on pollen counts and forecasts. So mold is a type of fungus that produces spores that float through the air, and it can grow on almost anything when moisture or damp environments are present. And it can be found both indoors and outdoors. So mold it's also a common cause of allergy and asthma symptoms. And mold seeds, which are also called spores, they essentially travel through the air. And when you upset a mold source, this can send the spores into the air. And this makes it easier for you to breathe them into your lungs, which can then trigger allergy and asthma episodes. But you can reduce your asthma and allergy symptoms by avoiding contact with mold spores. And some steps that can help include limiting your outdoor activities when mold counts are high. Also, remove leaves and piles of dead plant material or tree clippings as soon as possible. This is because mold tends to grow in dead plant material and tree clippings. Additionally, you might want to wear an N95 mask, hat, and sunglasses when you're caring for your lawn or garden. And if you can, try to have somebody without a mold allergy do your yard work if possible. And then finally, promoting groundwater drainage away from your house is important as well. Exposure to air particles in the smoke that's released during a fire can also irritate your lungs, and this can worsen your asthma symptoms. But again, there are steps you can take to help keep yourself safe. First, you want to track the air quality index in your area, and you can get current readings on airnow.gov. You can get it on weather sites and also on smartphone apps and from local news reports as well. Additionally, you want to try to keep your asthma under control as much as possible. So you may need to ask your allergist how you can prevent symptoms, and they might have you increase your medicines and decrease your outdoor physical activities while the air quality index is high. And then finally, working and exercising inside while the air quality index is high is important as well, if possible. That's because physical activity like exercise, it causes you to breathe faster and deeper, and this can pull more polluted air deeply into your lungs. But if you have to spend time outside, then it is best to wear the N95 rated mask. And this is because cloth masks and face coverings, they don't provide enough protection from wildfire air pollution. And when you are wearing the N95 mask, be sure to cover both your mouth and your nose and also protect your eyes. And then finally, you also want to improve your indoor air quality. So since you'll be spending more time indoors, it's equally as important to make sure that your indoor air quality is good. The polluted air, it can actually enter your home and get trapped there. And we'll discuss steps for improving indoor air quality in just a bit. So essentially, you want to be mindful of air quality and avoid spending a lot of time outdoors when air quality is poor, if possible. And you can visit the National Allergy Bureau at quadai or AAAI.org/NAB for pollen count information. Again, you can also visit airnow.gov for Environmental Protection Agency air quality alerts. And both of these websites, they also have apps that are available for smartphones and tablets. And additionally, local news reports often share pollen count and air quality information as well. And now I will move on to indoor trigger avoidance strategies.
We're going to talk a little bit about environmental triggers, things like dust, pets, and mold that Jessica talked about that can cause asthma and allergy attacks. And then they can be possibly life-threatening. We want to minimize exposure to those triggers and create a healthy environment if you have asthma and allergy. And so having good indoor air quality is a key component of this and essential for creating a healthy living space. So most people in the US spend about 90% of our time indoors, and our indoor air, believe it or not, can be 2 to 5 times more polluted than being outside. So we offer a free asthma-friendly home checklist on the website there at afa.org/healthyhome. It's in English and Spanish. And going through this can help you identify and reduce your indoor triggers. And if you're a renter, you can share this webpage and printable checklist with your landlord if needed. And we'll talk about some general strategies for improving your indoor air quality with you today. Okay, so how to improve your indoor air quality and reduce triggers in the home. Cutting down sources of allergens and asthma irritants through throughout your home is possible. Things like improving airflow in your home, so leaving interior doors open while running exhaust fans in bathrooms and kitchens can be a good strategy. Avoid harmful products. Things like pesticides and bleach and other harsh chemicals can trigger asthma and should be reduced as much as possible. Using those certified asthma and allergy friendly products, things that we know reduce allergens on bedding, using HEPA vacuums, cleaning products, things like that. Have a regular cleaning routine to remove dust, pollen, dander, and mold. Measure your home's humidity level. If you have moisture, try to keep it below 50%. You may need what's called a dehumidifier to reduce that moisture. Keep windows closed during peak pollen times, like Jessica mentioned, and also times of high outdoor pollution. Things like scents. So we love a good scented candle, but unfortunately, we know that things like scented candles or cleaning products can actually trigger asthma. So removing those from your home is recommended, and using things like battery powered ones. Carpets are a huge trigger potentially, so replace those if you can with solid surface flooring. Maintain your HVAC or furnace and air conditioning system, replace those air filters, use a portable air cleaner or air purifier in rooms where you spend the most time. Okay, so depending on where you live, obviously you all are in Ohio, there's going to be Ohio specific housing codes. And so it's ideal to for families not to be exposed to harmful asthma triggers. So by law, landlords are required to abide by state housing codes that protect people's health and people's safety living there. So this is just a quick snippet. You can check out your Ohio code at codes.ohio.gov if you're interested. And then local organizations like Ohio Healthy Homes Network may be a good resource to help. If you are a renter and you know that there are things in your home that are making you sick related to your asthma, here's some just general tips for talking with your landlord. We know that this can be overwhelming process for some, and people are worried about retaliation or losing the housing. So reaching out to a local resource, if you feel like that's needed to help with advocacy, that should be available. But one general tip is to first talk about the issue informally with your landlord. A conversation via email, via phone, however that works for you. Then you can start, this also kind of helps document your timeline, ideally putting that timeline in writing so you have it. If that doesn't work, you can formally communicate in writing and outline your requests as well. If they ignore your request, then you can notify your landlord that you may take further action if it's not resolved, and that you may have to, show proof that you tried to resolve it out of court. So definitely seek your local resources. I'm going to talk a little bit very briefly about AFA's resources. So that was a lot of information. Thanks for sticking with us. We are a national organization, but we do offer resources for anyone across the US. We have lots of resources on our free AFA store. We have a support center, which is a toll-free hotline available Monday through Friday, 10 a.m. to 3 p.m. Eastern Standard, except US holidays. We request 2 business days for a response. You can also email us, but if you have a question or need some guidance on how to live with your asthma, we can help with that. We have a couple online communities, which are online support groups that you can join. One is specific to asthma and one is specific to food allergies. We also have a learning catalog for families and patients, healthcare providers. We have some CEU opportunities if you have a credential that you need those opportunities. We have Ask the Allergist, which has some common questions about asthma and allergies that our board certified allergists can answer some general information. But this is definitely not substitute for medical advice from your physician. And then we talked a little bit about our asthma and allergy friendly certification program. You can learn more about that and those products at that website. Lastly, wanted to let you all know, AFA has partnered with some program advisors and created the Black Women's Asthma Alliance. And part of that resource is a Facebook group that is specific to this community. It's for caregivers who may be taking care of others with asthma or people that live with asthma themselves. It's a private group. We'd love to have you join us. Just scan that code with your phone camera, or you can get directly to the group by typing in afa.org/join BWAA to get to that group. So love to see you there. Really quickly going to talk to you about some safe cleaning products. The EPA has a nice list of things that you can buy over the counter. Their Safer Choice program, it is a label that can help consumers identify what might be healthier and for your lungs to have in your home. And then feel free to take a quick picture of this. Here's some great safer cleaning recipes with just a few basic ingredients. You can create household cleaners that we recommend, and believe it or not, are very effective and very economical too. We are obviously not with you all in person, but you can reach us if you have any questions at programs@aafa.org. And I'm going to end the slideshow here. Okay, so it was great to meet everyone. Thanks for your time, and we look forward to seeing you on our online communities or any other space. And again, thanks to the hosts for having us, and we hope you found this beneficial. Take care. Okay. Hi, everyone.
All right. So first off, we want to see if anyone has any questions. If you have any questions, you can either raise your hand or you can put it in the Q&A. The other is I hope that you found the video informative and that you found the session informative. There are a couple of things that I want to make sure that we hit on before we end. There were a couple of things that were talked about that we really don't talk enough about around asthma and some of the other triggers. Right now, because it is summertime, we have a lot of outdoor barbecues. We bring a lot of people either into our house or into other spaces. And so it's important for us to know that if we are grilling and we have people who have asthma in our home, that we want to close the windows so that the charcoal smell does not go through the house. And then if whatever we had on that we're cooking with, to immediately take it off so that we're not in close proximity to someone else in our household that it may trigger an attack. The other is I find it alarming that we talk about smoking and not vaping. But the other day I was walking through Macy's and there was a lady in Macy's that was vaping inside of the store. And so for people who are vaping to be mindful that vaping is smoking and that even if you are, when you're not outside, that you cannot use vaping devices inside of retail establishments or any establishments. It would be the same as smoking a cigarette and can also trigger people who have asthma, bronchitis, COPD, or emphysema. And so we want to make sure that we don't do that. The other part of this is around perfumes. When I first started working in a healthcare setting some 30 years ago, we had a brochure that basically said you cannot wear perfumes or colognes if you are working around patients. And that is because patients may have a reaction. So if they are if they have allergies that may trigger their asthma, or if they have asthma, bronchitis, COPD, being in close proximity of them with lots of perfume or cologne on could be a trigger. And so being mindful of where we are and what we put on our person in the morning, because some people put on a little bit of perfume or a little bit of cologne for their benefit, and others put it on where we can all smell it. Like we know that they have walked through the room or been in the room because we can smell the perfume and cologne. The other is around candles. They talked a little bit about that in the video. I love candles. So usually what I do is I open windows so that I can make sure that I can burn my candles. And so making sure that you are understanding what goes on when you're burning candles. And then the last part was about rodents. Um, if you are trying to, for many people who are trying to get rid of rodents, either roaches or bed bugs or other rodents, what they do is they'll buy the bombs to put off the bombs into their houses. And so they shut down all of the windows in order for the bombs to work. For me, if you think that you have bugs or rodents or bed bugs, to make sure that you're working with a licensed professional so that they can actually use um, um, some of the natural cleaners that they have. They have some things that are a lot better on us than others. Um, and then the other part is they gave you the menu of mixing up some things in order for you to help clean your house without buying a lot of the chemicals. So I don't know about you, but I remember going to my great grandmother's house when I was younger, and when she would clean, I could smell the vinegar because she would use vinegar to clean her glass and her windows and other things. And so making sure that we go back to basics, not using a lot of the other things that may trigger people in our household, or not mixing things. You know, I remember years ago, probably about 40 years ago now, I poured some bleach into something and didn't even think about it and poured some Comet in it to clean it. And it set off this reaction that cleared out my house. Like I had to go outside um, and air out that I had to go outside in order for me to breathe. But um, making sure that we're not doing that. And then just monitoring what's going on now with our weather. We're going to have some extreme weather patterns these next few weeks. And so making sure that if you are going out, that you are carrying a bottle of water. If your kids are in summer camp, making sure that they have an inhaler. If you are doing any kind of physical activity, and you know that you are asthmatic, making sure that you're limiting your time out in the heat, maybe doing things earlier in the morning or later in the evening. Um, and just monitoring yourself and your loved ones. The same with churches. We've had a lot of places who have had some air conditioners that have gone out. And so making sure that you're being mindful of that. The other is we have a booklet of information. And if you need some more, I know that Dr. Miner had gotten some from me, but if you need some more of these are information about asthma. So if you are a school nurse or a counselor or a community health worker and you need these in order for you to have them uh, out, to hand them out to your community that you're working with, or if you're a teacher or a principal and you want to hand them out to some of the parents that have children that have asthma at your school, we have this for you. So you just have to let us know. You can contact us at info@neobhc.org and we can get that to you. And the other thing is making sure that in the Q&A section that you have included your zip code, your name, your zip code. If you have a Cash App, if you can include that. Any of that information would be helpful to us. And Sharonda, I'm going to give you a chance to to make any other type of thing that you want to talk about your program to our attendees who
Sure.
may not have heard it at the very beginning.
Absolutely. So I did pull up the links and I'm going to share them in the chat box. So there are just a couple of things that, you know, if you have patients who have asthma, we are collecting stories about how asthma is going for Ohioans. So I just placed in the chat box the share your story link. All you have to do is click on that. It'll come right to us. We don't release any names or anything like that, but it does allow us to kind of get a collection of stories for how asthma is impacting the community. The next thing that I added is the asthma educational series that I talked about at the beginning. Again, that's available on YouTube. That's a link to the ODH YouTube page. But Ivanka also has it on her YouTube page. So wherever you get your YouTube, feel free to check that out. It goes over a ton of different educational activities, from like what is asthma, how to use an inhaler, what is an action plan, warning signs and triggers, allergic reactions, indoor outdoor air quality, as well as breathing exercises. So if you are not familiar with those things, you certainly want to become. And then for the providers in the room, I dropped a link where they can order asthma materials from ODH, 100% free, right? And so those are just additional resources that the community has. Thank you so much for inviting us today.
Thank you. I appreciate that. And we are also going to send you the videos that she talked about. So you're going to get those in your email. So that's one of the reasons why also that we're asking for your emails. And then we'll have another opportunity that we'll be doing listening sessions. So if you or someone you love has asthma and you want to sit down and talk with us a little bit about that, we'll have a couple of listening sessions that will be coming up. And there will be an opportunity for us to do a deeper dive with you to ask some additional questions of you. So if you know that that is something that you want to participate in, please let us know. Everyone else, that if you have not included your information in the Q&A, if you could do that for us. And I'm checking to see, I'm running through here to see if we have any additional questions or concerns from anyone before we leave out for the day. And make sure that you include that zip code. And we have some other things that are coming up too around an advisory committee looking at air quality in this area. So if you live in Maple Heights, if you live in Euclid, or if you live in East Cleveland, we would definitely love to have you as part of a breakfast meeting that we're going to have on the 27th from 9 to 11 a.m. So I thank you all for your time. If there are not any other questions, I'm going to give you back 9 minutes of your day. And everyone have a great day. Thank you so much.
Thank you.